So BIRC3 is located in chromosome 11, and up to 20% of CLL cases at diagnosis have a monoallelic 11q deletion, most of them including BIRC3 within this deleted region. And some of these patients actually do have a mutation on BIRC3 in the remaining allele, so the functional consequence is that there is no BIRC3 protein, no functional. Specifically these patients with a biallelic BIRC3 loss, it's been found that they really have poor responses to chemotherapy, and also they have a much shorter progression-free survival or overall survival. So that's why we are interested in looking at in knowing more about the functional impact of these mutations, because it looks like they have a clinical significance. So chronic lymphocytic leukemia is a heterogeneous disease which is characterized by the presence of a lot of chromosomal abnormalities of gene mutations. And one of these recurrently mutated genes is called BIRC3, which is mutated in about 5% of CLL cases at diagnosis, but it's been found that in cases at relapse, this percentage increases. So in our work, we focused on emulating these BIRC3 alterations in vitro models. And we found that indeed when we use the CRISPR-Cas9 system, and when we introduce these alterations in cell lines, we found that they conferred a proliferative advantage over the cells without BIRC3 alterations. And we confirmed this in a xenograft model, in an in vivo model, and we also found the same.